The LookSpot system is a COVID-19 antigen rapid test for the detection of SARS-CoV-2 virus from patients suspected of COVID-19 within the first 8 days of symptom onset. The test result is obtained within 5 to 8 minutes. The Look COVID-19 antigen LookSpot reader is easy to use by trained professionals for point-of-care applications. With the LookSpot reader, you will receive, in a separate package, enough material for 10 tests. This includes nasal swabs, extraction buffer tubes, antigen sample cassettes, and an information booklet. This is the training video for LookSpot. Download the LookSpot app from the app stores and install it. For Android phones, please make sure your phone has Android OS 7.1 and above. For iPhone, make sure your phone is iPhone 6 and later models with OS 13 and above. For the list of supported phone models, please check lipac.com Frequently Asked Questions page. Register yourself with the app, providing an email address and password. You will receive an email to confirm your email address. Then you are ready to begin. Clamp the LookSpot reader to your phone by aligning the lens of the LookSpot reader with the camera of the phone. Adjust the wheel and slide the guide rail to find the optimal position for the alignment. If the size of your phone is too big or too small to fit in the guide rail, remove the guide rail and use the double-sided adhesive Velcro strips. This can also be applied to phones using protective cases. With the LookSpot reader attached to the phone, press the power button to turn on the LookSpot. Open the cell phone's camera app and look for the cross mark. The cross mark must be in close to the center of the screen. If the phone has multiple cameras, this step will ensure the correct camera is used for the test. When finished, close the camera app. Open LookSpot app. Enter the place, city, and country info, then proceed to the setup screen. Press the X mark where it says LookSpot Reader Connected to see the available LookSpot within Bluetooth signal range. Select the correct LookSpot based on the MAC address of your reader. Press Return to the setup screen. Insert the calibration cassette that comes with the package. Press the X mark where it says Camera Calibrated to enter the calibration screen. This calibration process will automatically calibrate the camera with the calibration cassette. Remove the calibration cassette once it is done and return to the setup screen. Now it is ready to start the test. For sample collection, always use proper personal protective equipment, PPE, for the handling of patient samples. For the best test results, please use the nasal swabs in the test kit to collect the nasal sample. In order to obtain as much secretion as possible, the nasal swab must be inserted into the nostril where there is more secretion and nasal drainage. Push the swab until stopping at the level of the turbinate, approximately 1 inch into the nostril. Rotate the swab 5 times or more against the nasal wall, then slowly remove it from the nostril. Repeat the same process in the other nostril with the same swab. The freshly collected sample should be processed as soon as possible, and it is recommended to complete the test within 1 hour after sampling. Place the patient nasal swab sample into the extraction buffer tube. Roll the swab at least 5 times while pressing the head against the bottom and the side of the tube. Leave the swab in the extraction buffer tube for 1 minute. Roll the swab head against the inside of the tube as removing it. Dispose of the used swab in biohazard waste. Fill the disposable dropper with the patient sample from the extraction buffer tube. Squeeze the bulb and slowly release the pressure on the bulb to fill the dropper. Dispense 3 drops of sample to the sample window. Use the dropper only. Do not touch the cassette with the tip of the dropper. Insert the test cassette into the LookSpot reader. The LookSpot reader will detect the test cassette as valid with the embedded microchip. Press the tab that says Proceed to detect SARS-CoV-2 on the screen and wait for the results. Leave the LookSpot on a flat surface so the antigen cassette will not move, which can affect the test results. The test result will show up in 5 to 8 minutes on the screen. Remove the test cassette and dispose of it in biohazard waste. The look spot reader will sterilize automatically with an internal UV light, and it will be ready for the next test. If the result is invalid, please redo the test using a new nasal swab and a new antigen cassette. When the antigen in the sample is lower than the detection limit of the product, incorrect sample collection or transportation will lead to false negative results. Therefore, a negative result cannot rule out the possibility of SARS-CoV-2 infection. Comprehensively evaluate the patient's contact history, medical history, and clinical symptoms. At times, a molecular diagnosis PCR test is used to confirm the diagnosis.